Relationship between fibromyalgia and shoulder pain. There is no doubt that shoulder pain is miserable pain within the shoulder space, joints and muscles that will or may not restrict what your arm is going to do. Much of this pain originates in the tissues and bones in the shoulder, and you can also feel the pain in the center of a physical activity or when you move your arms. These questions arise in many ways between fibromyalgia and pain in the shoulder, one of which is that if there is a relationship between fibromyalgia and pain in the shoulder. However, in order to understand this correlation, knowing what causes shoulder pain and how we can get rid of it is critically essential. The causes of shoulder pain. The shoulder is made up of three completely distinct bones: the longum hyoidus, the OS, and hence the clavicle. The os longum sits in an excessively socket in your OS, which is why the muscles and tendons show that the arm is safe during this socket. Once we feel pain in our shoulder, S, it is sometimes due to inflammation or tendon tear, arthritis, nerve injury, a fracture, or a broken bone. Tendons are the cords that hold our muscles to our bones, however comparable they will change over time to almost anything. Those frequently affected by square measurements in physical activity can see that their tendons can change much faster than those not. As our tendons impact, they appear to be torn or injured far more. This injury will develop over time or occur in an unexpected manner, and if they are unhealthy, the connective tissue will be completely divided. Once the OS puts pressure on the tissues, something else that can trigger shoulder pain. Once the arm is lifted or involved in any physical activity, the tissues are rubbed against the top of the OS, which could further add to the tendon pain. This sort of pain is particularly painful and severely limits what movement you'll kill your arm. Maybe you enjoy baseball, for instance, and often lift and move your arm by throwing the ball on top of your head. Here, this kind of injury, called shoulder impingement, can eliminate your capacity to execute that range of movement at once. Common reasons behind pain in the shoulder are inflammatory diseases, and in addition, square measures several variants. The rationale for the presence of square measure terribly numerous alternatives, types of inflammatory disease is that it will happen in different body parts. The sort of inflammatory disease that occurs inside the shoulder is called degenerative arthritis, and its usual symptoms embody pain and rigidity inside the shoulder and inflammation. If you show the symptoms of degenerative arthritis, you must have it checked out like a shot, as the pain can only worsen with no significant therapy as long as it goes on. Degenerative arthritis sometimes occurs in those who measure square middle-aged and is due to the spread of different variables as well as inflammation in the joints, infection, trauma, or sports. The most prevalent response with those with degenerative arthritis is not to push their jostle order to minimize pain, but this can make things worse because it will lead to additional shoulder stiffening. A fracture may be the last significant explanation for shoulder pain that we tend to get to quote square measure. A fracture is once broken bones within the square measure of the body, hence prevalent broken bones which can trigger square shoulder pain to measure the longum clavicle, OS, and hyoidus. Nearly always square fractures of the shoulder and broken bones evaluate the outcomes of physical trauma, such as experiencing a sport injury, falling, or being involved in an incident and associate in nursing. A fracture in the impacted room can trigger serious swelling and intense pain. If you have experienced a fracture, you need to get your doctor's medical attention as soon as you can. Your doctor can provide you with a selection of therapy and can officially diagnose wherever the fracture occurs. Fibromyalgia and shoulder pain. Fibromyalgia is a worst medical world mystery, as we have a tendency not to comprehend all of its causes, however, or perhaps how it occurs. It is calculable that fibromyalgia alone affects between 5 and 10 million Americans, the overwhelming majority of whom are women. Additionally, it is thought that fibromyalgia runs within the family, as people with a case history of fibromyalgia square measure to develop it themselves much more apparently. In addition, middle-aged women square is most likely to develop fibromyalgia in the foreground, however it's occurred in young adults, teenagers, and even young youngsters too. Pain and fatigue are the main symptoms of fibromyalgia. This can be enough to significantly restrict what the patient is in an overwhelming situation to achieve in a day, as several square measure of fibromyalgia patients decreased for a lot of the day to birth in bed. The muscle pain sometimes occurs inside the throat, back, chest, rib cage, thighs and hence the shoulders and may get worse over time. There is a square measure of 18 pressure points throughout the body, and in 11 of those pressure points it requires someone to feel pain to be officially diagnosed with fibromyalgia. A square measure of 1 or 2 of those pressure points positioned inside the shoulders. If you're feeling pain in your shoulders, there are 2 choices on however it's connected with fibromyalgia. 1. You don't feel pain in any of the opposite tender points, so you don't have fibromyalgia, so the pain is due to the causes we've already listed. 2. In addition to your shoulder, you feel pain in the various pressure points that your shoulder pain may be an area of fibromyalgia. Stay healthy. Thank you for watching this. Please do not forget to subscribe, share and like our channel. Click the bell icon for latest update.